Have you ever wondered why your erections aren't as firm as they used to be? Many men think it's all about testosterone or blood flow. But here's the hidden truth. The strength of your pelvic floor muscles plays a massive role. These are the muscles that lock blood inside the penis and keep you hard. And just like any other muscle, if you don't train them, they weaken with age. That's where Kegel exercises come in. Most people think Kegels are only for women, but in my clinic, I've seen men in their 50s, 60s, even 70s transform their performance simply by strengthening these hidden muscles. Today, I'll show you the 5 best Kegel moves that you can do at home without equipment to support firmer erections, better control, and even improved bladder health. Stay with me until the end because the final move is the one most men skip, but it's the real game changer for lasting firmness. Lie down comfortably on your back with your knees bent at about a 45 degrees angle and your feet flat on the floor positioned hip-width apart for optimal stability. Place your arms gently at your sides with palms facing down so your body feels fully supported and relaxed. Take a moment to settle into this position, allowing your breathing to become natural and steady. From this position, bring your attention to your lower back region. Gently tighten your abdominal muscles. Think of pulling your belly button toward your spine and press your lower spine firmly into the floor as if you're ironing out any space or arch underneath it. At the same time, tilt your pelvis slightly upward, just enough to feel your muscles engage without straining or creating discomfort. You should feel a subtle but distinct contraction in your lower abs and deep pelvic muscles. Hold this position for 3 to 5 seconds initially, breathing steadily through your nose, and then slowly release back to the starting point with control. What you're doing here may look simple from the outside, but it is remarkably powerful for your sexual health. You're not only activating the pelvic floor muscles, but also connecting them with your lower abdominals and creating what experts call co-contraction. These are the very muscles that contract rhythmically and lock blood inside the penis during an erection, acting like a natural ring. By practicing this move daily, you're training those muscles to work together on command, building both strength and coordination. Another crucial benefit of the pelvic tilt is body awareness, what physical therapists call proprioception. Many men don't realize how to consciously control their pelvic floor until they start practicing this foundational movement. It's like discovering you have a muscle you never knew existed. Over time, you'll begin to feel exactly which muscles are firing, where they're located, and how to engage them more effectively when you need to. This enhanced awareness can mean firmer, more reliable erections, better control during intimacy to delay ejaculation, and even significant improvements in bladder strength that reduce urgency and frequency. Start with 10 to 15 repetitions, holding each tilt for those crucial few seconds. Focus on quality over quantity. It's better to do 10 perfect reps than 20 sloppy ones. As your muscles grow stronger over the coming weeks, gradually work your way up to 20 or even 25 repetitions with consistency. And this is key. You'll notice that your body responds differently. It feels as if you are locking in firmness rather than letting it slip away. Some men even describe it as reclaiming control over a part of their body they thought they had lost forever to aging. Next, we have the prone stretch. For this one, lie face down on the floor on a comfortable mat or carpet with your legs fully extended and your elbows placed directly under your shoulders, almost like you're beginning a gentle cobra pose or preparing to read a book while lying down. Your forearms should be flat on the floor parallel to each other. Lift your chest slightly off the ground, keeping your neck neutral and your gaze forward or slightly downward to avoid neck strain. From here, engage your abdominal muscles by gently pulling your belly button in toward your spine. Imagine trying to create space between your stomach and the floor and lightly contract your pelvic floor at the same time. Think of gently lifting those deep muscles as if stopping urine mid-flow. This move may not look particularly demanding to an observer, but what it delivers internally is unique and powerful. It lengthens and stretches the muscles in the front of your abdomen, including the hip flexors that often become tight from sitting while forcing the deeper stabilizers, the pelvic floor, the transverse abdominis, and the lower abs to contract in perfect harmony. That balance of stretching and contraction is what makes this exercise so remarkably effective. It doesn't just build raw strength, it builds flexibility, endurance, and muscular coordination, which are all essential for optimal sexual performance and maintaining erections. Many men who make the prone stretch a regular part of their daily routine report a noticeable reduction in chronic lower back tension, significantly improved posture throughout the day, and most importantly, a stronger, more conscious connection to their pelvic floor during intimacy. That enhanced connection means when the moment comes, the neural signals between your brain, your muscles, and your erection are clearer, faster, and stronger. It's like upgrading from dial-up to broadband for your nervous system. Hold this stretch for 20 to 30 seconds at a time initially, focusing on steady diaphragmatic breathing and gentle but deliberate muscle activation. Don't hold your breath. Oxygen flow is crucial for muscle function. Repeat it 3 to 4 times with 10 to 15 second rests between holds. As you progress over weeks of consistent practice, gradually increase the hold time to 45 seconds or even a full minute. You'll find that your pelvic region feels both looser and stronger simultaneously. The exact combination you need for lasting firmness, better blood flow, and superior control. The third move is the kneeling abdrawn. Begin by getting onto all fours in what yoga practitioners call the tabletop position, placing your hands directly under your shoulders with fingers spread wide for stability and your knees positioned directly under your hips. Your spine should be completely neutral, not arched like a scared cat or sagged like a hammock, but naturally straight. This position alone helps align your entire body and removes unnecessary strain from the lower back while preparing your core for activation. Now take a slow, deliberate exhale through your mouth. As you do, gently pull your belly button in toward your spine, flattening your stomach without holding your breath or creating tension in your shoulders. At the same time, contract your pelvic floor muscles. Imagine for a moment that you are trying to stop the flow of urine midstream, or visualize gently lifting your testicles or lightly drawing the muscles inside your pelvis upward. Hold this coordinated contraction for 3 to 5 seconds while keeping your shoulders relaxed, your neck neutral, and your breathing smooth and controlled. Then slowly release with control. This movement may look minimal from the outside, but what's happening inside your body is profound. You're activating the deep core muscles, particularly the transverse abdomen, the ones that wrap around your midsection like a natural corset or weight belt, while simultaneously training the pelvic floor to work in sync. Together, these muscles create spinal stability, improve pelvic circulation, and strengthen the neural connection between your brain and your sexual function. What makes this exercise particularly unique and valuable is the way it links conscious breathing and precise muscle control. By learning to contract on the exhale and relax on the inhale, you're training both endurance and coordination, two things that directly translate to more staying power and conscious control in the bedroom. Men who practice this move regularly often describe discovering a new level of awareness of their pelvic muscles they never knew was possible. Instead of feeling disconnected or out of control, they can sense and consciously control those contractions more easily, which helps them stay firm longer and delay climax when they choose, a skill that enhances both their pleasure and their partner's satisfaction. Start with 10 to 15 repetitions, always moving slowly and steadily with full concentration. Quality matters far more than quantity here. Over time, increase the hold to 5, 7, or even 10 seconds as your endurance improves. You can also try variations such as slightly shifting your weight forward or backward to engage different muscle fibers. The fourth exercise is the bridge abduction. Lie flat on your back on a comfortable surface with your knees bent at roughly 90 degrees and your feet hip-width apart, firmly planted on the ground about a foot from your buttocks. Place your arms at your sides with your palms facing down for support and stability. Take a moment to find your neutral spine position. Now press your heels firmly into the floor. Engage your glutes and lift your hips up toward the ceiling, forming a perfectly straight line from your shoulders through your hips to your knees. This is your bridge position. Hold it steady while maintaining the bridge with good form. Gently push your knees outward as if you're trying to spread the floor apart with your legs or stretching a resistance band. Then bring them back to the starting point with control. The movement should be smooth and deliberate, not jerky or rushed. What makes this move so incredibly powerful is that it works multiple crucial muscle groups simultaneously in a coordinated fashion. You're strengthening the pelvic floor muscles, which help trap and maintain blood inside the penis during erection, while also powerfully activating the glutes, the largest and most metabolically active muscles in your body. On top of that, you're targeting the often neglected hip abductors and stabilizers, which are essential for pelvic balance, stability, and optimal circulation. When these muscles are weak or inactive, blood flow to the pelvic region is often significantly compromised. But when they're strong and responsive, they act like auxiliary pumps, helping drive fresh oxygenated blood where you need it most for strong erections. The bridge abduction also effectively retrains your body to hold firmness under pressure and movement. By keeping the hips elevated while dynamically moving the knees in and out, you're simulating the kind of muscular control and endurance needed during intimate encounters. This functional strength translates directly to better performance. Start with 8 to 10 repetitions, holding each outward push for 2 to 3 seconds before returning to center. Focus on keeping your core engaged throughout to prevent your back from arching. As you grow stronger over weeks of practice, increase the number of reps to 15-20 or add a resistance band around your thighs just above the knees for extra challenge and muscle activation. Men who stick with this exercise consistently often report not just noticeably firmer erections, but also improved pelvic stability and hip mobility, meaning less fatigue, reduced lower back strain, and greater control during longer intimate encounters. It is truly one of the most effective moves for building a strong, stable foundation that supports both sexual performance and overall confidence in your body. Finally, the most overlooked but incredibly powerful move, the rocking frog stretch. Begin by getting down on your hands and knees, positioning yourself on all fours on a padded surface or yoga mat for comfort. From there, slowly and carefully widen your knees apart. Go as wide as feels comfortable without strain, keeping your feet turned outward so that your inner thighs are fully open and your hips can sink lower toward the floor. Your knees should form a wide V shape. Now, gently lower down onto your forearms, keeping your spine neutral and your head relaxed. This position may already feel like an intense stretch through your inner thighs, groin, and hips, and that's exactly what you want. Take a moment to breathe and adjust to the stretch. Once you are comfortable and stable, start rocking your hips forward and back in a slow, controlled, rhythmic motion, almost like a gentle wave moving through your pelvis. What this move does is truly unique in the world of men's pelvic exercises. It deeply stretches the adductors or inner thigh muscles while also opening up and releasing the deep pelvic floor muscles that often become chronically tight with age, prolonged sitting, stress, or lack of flexibility training. When those tissues are tight and restricted, they create a tourniquet effect that restricts blood flow and creates excessive tension in the pelvic area, which makes it significantly harder to get and maintain strong erections. By gently opening and relaxing these muscles while simultaneously engaging your pelvic floor in a dynamic way, you allow blood to flow more freely into the erectile tissue and crucially stay there when you need it. The rocking motion is particularly important and shouldn't be skipped. It doesn't just provide a static stretch. It creates fluid movement through the entire pelvis, which dramatically improves circulation, promotes lymphatic drainage, and trains the muscles to activate and relax in perfect harmony. That balance of strength and relaxation is absolutely critical for sexual function. Too much chronic tension in the pelvic floor can restrict blood flow and cause premature ejaculation, while too little strength fails to lock blood in for firm erections. This exercise helps you find and maintain that sweet spot of balanced muscle tone. Spend 30 to 40 seconds in this position initially, moving gently with the rhythm of your breath and breathing deeply into your belly. Focus on relaxing into the stretch rather than forcing it. Repeat the stretch 3 times with 20 to 30-second breaks between sets. If you find the position challenging at first, don't force it or push through pain. You can modify by not going as wide with your knees or by placing a pillow under your chest for support. With consistent practice, your flexibility will improve dramatically, and the stretch will feel more natural and even pleasurable over the course of just a few weeks. Many men notice a clear, significant difference in firmness, sensitivity, staying power, and even the intensity of their orgasms. Some report that this single exercise feels like it unlocks or awakens the pelvic region, allowing them to experience a stronger, more responsive erection than they've had in years or even decades. Think of the rocking frog stretch as both a strengthener and a releaser. A yin and yang exercise. It builds control while releasing chronic tension, restores healthy circulation while teaching your body how to move fluidly and naturally, and ultimately supports both peak performance and lasting comfort. When paired with the other 4 exercises in this routine, it becomes the finishing touch. The one move that can take your results from good to genuinely great. So there you have it. The 5 best Kegel moves to restore harder, more reliable erections after 50. These are not quick tricks, temporary fixes, or gimmicks that overpromise and undersell. They are practical, scientifically proven exercises that systematically retrain your body to hold blood flow, increase penile sensitivity, and give you more conscious control over your sexual response. The key to success is consistency and patience. Just 5 to 10 minutes a day, less time than you spend brushing your teeth, can lead to noticeable improvements within a few weeks with more dramatic results after 2 to 3 months of regular practice. And remember, these exercises don't just help with erections. They also significantly improve bladder control, reduce nighttime urination, alleviate pelvic tension and pain, and support overall confidence in your body and your masculinity. For best results, perform these exercises daily, ideally at the same time each day to build a habit. Many men find success doing them first thing in the morning or right before bed. Track your progress in a journal, noting improvements in firmness, control, and overall sexual satisfaction. Stay committed. Try these moves daily without fail. And you may be genuinely surprised at how much stronger, firmer, and more youthful you feel. This is Dr. Sophia Carter wishing you health, vitality, and confidence at every stage of life. Remember, it's never too late to strengthen these crucial muscles and reclaim your sexual health. If you found this helpful, share it with a friend who could benefit from this knowledge. And don't forget to subscribe for more evidence-based men's health guidance.